Good morning, ladies and gentlemen. I'll begin with some organizational matters, as I think probably some people not in the building are still logging on, but these affect the people in the building. So please take note of our health and safety information. You have a visitor pass, which you need to wear at all times, with the lanyard also clearly visible. They don't unlock many of the doors on other floors and entry doors. So if you leave the area, go downstairs and go out, you won't be able to get back in. Those of you with visitor passes, so please do, if you need to, liaise with staff, but hopefully all your requirements will be fulfilled on the floor here. Coffee breaks will take place in the lobby, and the bathrooms are, if you go out, turn right, you have coffee on the right, or bathrooms a bit further on the left. The meeting is being externally broadcast, and presentations will be published on our website about 2 weeks after the meeting, along with other material. So I need to remind everybody that the people listening outside the room cannot hear you unless you're using the microphone. So please, first of all, switch on the microphone before starting to speak. And secondly, do introduce yourselves on each occasion, because whilst we in the room can see who's speaking, those outside can't, so please introduce yourselves. It's also necessary to switch off the microphone when you finish, so the next speaker has proper use of his or her microphone. I think that's all for the administrative arrangements. So the last one is, of course, in the event of fire or other emergency, you will hear the alarms and given instructions from the loudspeakers, and EMA fire marshals will assist you in their high-vis jackets as required. If any of you need assistance during the evacuation, please let our colleagues know, and the fire marshals will assist you. So with that, it's a pleasure to open this meeting. I'm Fergus Sweeney. I'm Head of Division for Pharmacovigilance, Inspections and Scientific Committee Services. This is our 12th stakeholder meeting on pharmacovigilance. And these meetings are important because they provide an excellent forum for exchange of information between the many different stakeholders and authorities involved in pharmacovigilance. We have a broad representation here, and I assume online as well. We certainly get a very high attendance online. I'd like to take the opportunity first to welcome Sabine Strauss as new chair of the PRAC, recently elected. I think it's an excellent opportunity to hear also from her in her new role. And whilst he's not here today, also to welcome Martin Huber of BfArM, who's been elected vice chair of PRAC to work with Sabine. So very welcome. Our pharmacovigilance system, our EU pharmacovigilance system, has gone through a lot of change now over the last years, and with November 2017, with the release of the upgraded eurovigilance system with its additional functionalities, additional basis for access to information from different stakeholders, and also with, before that, having passed the milestones of a first public hearing in 2017, we can say we have fulfilled the ambitions and intentions of the new pharmacovigilance legislation, but we need to build on that. I think I use the word, say, fulfilled ambitions. I think the ambitions still need further fulfillment, and this meeting really is to discuss in part how we can move forward with that. We have a pharmacovigilance system which is respected and admired around the world, but it will only retain that respect and admiration so long as we work on it and so long as we pursue our engagement with the public and the dialogue and transparent dialogue we have with the public. 2018 and beyond will be a period of continuous improvement to serve the public better, and that improvement should be based on measuring the impact of what we do by being open to opportunities for new science and new technologies, and by listening to our stakeholders. And that's the foundation of this meeting, listening to our stakeholders. And there are two focus points: how we engage with the public, with a particular focus on listening to patients, and secondly, looking forward, hearing views from the different stakeholders on pharmacovigilance in the next 5 years. What shape will it take? What technologies will we use? How will we improve? What do we do? And particularly coming back to the word impact, how will we improve better that the things we do really deliver for public health? We have a common goal to promote public health and the well-being of EU citizens. And indeed, much of what we do contributes also to the health of citizens worldwide. And I think it's important to reflect on that. Your collaboration is critical to the ongoing success of EU pharmacovigilance. And I'm really grateful, we are all really grateful to the very active contribution of patients and healthcare professionals in our committees and in our wider interactions with you all. So thank you everybody for being here. I wish you an excellent meeting, and I'll hand over, I think, to Peter to take on the rest. Thank you.